The normally developing child enjoys the world of sound every waking hour. He responds to sound from the time of birth. Early in infancy, he begins to babble, then he learns to listen and to imitate some of the speech sounds he hears. A little later, he begins to learn what sounds mean and to differentiate among them. Soon he learns to talk. He talks because he hears and as he hears. Audition, as in the newborn, is largely reflexive. Hearing, on the other hand, is learned behavior. It involves sensitivity, discrimination, recognition, understanding, interpretation, memory, recall, and usually an appropriate motor response, a turning of the head toward the source of interesting sound. This involves general motor development and organization. At a few hours of age, the newborn will respond typically to certain kinds of short, sharp, fairly loud sounds with a startle reflex, which may be a Moro reflex, a blink, or other eye and body movement. When sound is the stimulus, this is called an auditory reflex. Through the next few months, his responses are immature, fleeting, and variable because his motor system is not yet far developed. The responses you will observe in a few moments are of this nature: Moro reflex, a widening of the eyes, change of expression, a jerk of the head toward the sound, and searching eye movements.
Baba, hello there, Baba. Baba, hello there, baby. Ah.
By the age of 8 months, there is a sharp developmental contrast. The baby has now learned to listen and hear. His motor development has progressed, and he relates spatially to many sounds in his environment. He should respond sharply and alertly by turning his head toward the source when he hears a quiet, interesting sound. If he consistently fails to locate the source of sound by turning his head, his responses are not normal. He may not hear well, he may be retarded in either motor or intellectual development. In the auditory screening tests you're about to see, 2 babies will respond normally and 2 will fail to react appropriately for their ages.
Therefore, it's very important to give her regular meals now and a good balanced diet. This will lay the groundwork for future good eating habits. By the looks of your little gal, you're doing a fine job. Just keep up the good work.
Thank you.
Now we're going to make some quiet sounds and see what Ann does. Before we begin, could you tell me something about her response to sound at home?
She's very alert to sound.
You feel that she hears them?
Definitely, yes.
Is she doing any babbling?
Oh, yes.
Are you able to recognize any of the sounds?
Well, Dada, Baba.
Oh, good.
The usual
Fine.
ones.
Is there any hearing loss or hard of hearing in your family or in her daddy's family?
No, none at all.
Good. I believe Brother Bobby is now 3, is that right?
Yes, that's right.
Good. Is he talking?
Oh, yes.
Do you or your friends understand what he says?
Yes, we do.
Fine. Is Anne sitting by herself now? I believe she is.
Yes, she is, since she was 6 months old.
Good. Has she been able to pull herself now to a standing position?
Yes. Mm-hmm.
And is she trying to creep?
Mm-hmm. Yes.
Oh. Now, since the last time we saw her, has she had any illnesses? What I mean is illnesses such as colds, ear infections, perhaps any of the childhood diseases?
Yes. 2 weeks ago, she did have a serious cold, but now she seems to be all right.
Oh, that's good. At least she's well for today's little test.
Uh-huh.
Now, I think we can get started, okay?
Fine, fine.
Hi, honey. Hello there. How do? How are you? There it is. Boo. What an expression. Hi. Hi. You found it. Bye-bye to you. Hello, Baba. Hello there, Baba. Baba. Vanessa. Hello, Vanessa. Peekaboo. Hello, little friend. Hello there, baby. Aren't you a lovely little girl? Come on, Baba. Hello there, Vanessa. Baba. Oh, you saw me. You saw me. Yes, you did. Baba. Hello, Baba. Baba. Hello, Vanessa. Hello, little girl. Come on now. Baba. Hello, Baba. Whew, you're quick. There it is. Hi there, Lisa. How do? Hello, Baba. Boo. Peekaboo. eyes rattle. Here I am. That was fine. Fine. Hello, Baba. Baba, 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 Baba. Hello there. Hello there, little friend. Hello. Baba, 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 Baba. Hello, Baba. Hello there. Hello, Baba. Baba, 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 Baba. Come on. Hello there. Baba, 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 Baba. Hi, Brucey boy. Hello there. Found it. Ah, there it is. Hi. Oh, I do. Hello, Baba. Hello. Well, greetings. Greetings, friend.
This auditory screening test can and should be given as part of every examination of an infant by the time he is 8 or 9 months old. This is not a measurement of hearing, even though the test sounds are carefully calibrated for frequency and intensity. The screening test serves only as an index. It selects the babies whose lack of normal response to sound suggests the importance of careful, detailed clinical tests and measurements. Those who fail the screening test once are tested again at a later date. If they fail the second time, then they require careful otologic, audiologic, neurologic, and psychologic examinations in special clinical centers where refined evaluations can be made. The child, the family, and the community are vitally concerned with all aspects of these problems, whether they involve hearing and speech development, motor coordination, or mental capacity. It seems obvious that if a child with a communication disorder is to be given the best possible opportunity by early recognition and definition of his difficulties, the better will be his chance to learn. This ensures hope for the child and his needs, and the family and their adjustments, so that they may rightfully take their place in the community which sustains them both.